Good morning. Thank you for attending this unscheduled COVID-19 briefing. This morning I'll provide an update on COVID-19 in PEI, and in particular we've announced 5 cases in the last 2 days, and currently we have 6 active cases in the province. So to start with, on Wednesday we announced 2 cases related to travel within Atlantic Canada, a female in her 20s and a female in her 30s. Contact tracing is complete, all tests to date are negative, and close contacts remain in self-isolation and will be retested in a few days. These cases traveled within Atlantic Canada and were subject to self-isolation upon return to the province. As I mentioned publicly, this matter was referred to enforcement, and I was informed that one of the cases has been charged with 2 infractions under the Public Health Act. I now want to turn my comments to the situation of the 3 cases that were announced in the press release last evening. Late yesterday afternoon, we were advised of 3 new cases in the Summerside area, all males in their 20s. These cases are close contacts of each other and have mild symptoms and are now self-isolating. Our investigation of the 3 cases is still ongoing, but at this point, these cases have not been linked to travel. Our investigation and contact tracing is underway, and we will learn more about this situation in the coming days. Last evening, we spoke to the 3 cases and identified an initial list of their close contacts. At this point, 39 close contacts have been identified. Last evening, our team called the close contacts and directed them to immediately self-isolate, get tested today, and remain in self-isolation for 14 days from their last contact with a positive case. Close contacts must remain in self-isolation regardless of their test results. Public Health will continue to work with the cases to identify any additional close contacts. However, we were unable to reach all of the close contacts last evening and are asking for help from the public. For example, some of the phone numbers are no longer active. So anyone who is at the Iron Haven Gym in Summerside between 6 and 8 p.m. on Saturday, February 20th, and 6 to 8 p.m. on Tuesday, February 23rd, are considered close contacts. If you were at the Iron Haven Gym at these times and have not yet received a call from Public Health, please immediately begin self-isolating, be tested, and remain in self-isolation, and help us by identifying yourself by calling 1-800-958-6400. I need to say that when people are identified as a close contact, it is very difficult for these individuals. It impacts businesses, it impacts families, people's income, and their day-to-day life in general. If you know someone who is self-isolating, please reach out from a distance to offer support. There are a number of other public notifications. Anyone who is at the following locations should immediately self-isolate and be tested for COVID-19. Following an initial negative test, individuals should monitor themselves closely for symptoms and isolate and be tested if they develop any symptoms of COVID-19. Individuals at these locations need to be vigilant and monitor themselves closely after an initial negative test. These include the Breakfast Spot in Summerside, Saturday, February 20th, between 7 a.m. and 2:30 p.m. Domino's Pizza in Summerside, on Wednesday, February 17th, between 10 a.m. and 6 p.m. Thursday, February 18th, between 4 p.m. and 11 p.m. Friday, February 19th, between 11 a.m. and 6:30 p.m. Saturday, February 20th, between 10 a.m. to 6 p.m. Sunday, February 21st, between 4 p.m. and 1 a.m. Tuesday, February 23rd, between 5 p.m. and 1 a.m. And Wednesday, February 24th, between 11 a.m. and 6 p.m. Thank you to these businesses and employers for cooperating with our office and for going above and beyond to assist public health in our investigation. Our focus today is testing. Close contacts are being tested, and also individuals who were at the above locations at the times noted should be tested, even if they do not have symptoms. And of course, as we have said during this pandemic, but particularly now, anyone in the Summerside area with any symptoms of COVID-19 should be tested and isolate until they receive negative results. Testing clinic hours at Slemon Park have been extended from 8 a.m. to 8 p.m. today. And depending on demand, the need to provide additional testing capacity over the weekend will be assessed. Testing clinic hours in O'Leary have been extended from 10 a.m. till 4 p.m. today for anyone with COVID symptoms. There will be an announcement later today to confirm testing clinic hours on the weekend. Although the identification of 5 new cases in the past 2 days is not what we want to be announcing, this situation is not unexpected given what our neighboring provinces have experienced in the last weeks. Public health will be working diligently over the coming days to identify a source for the cluster of cases in the Summerside area. We know that there must be a travel link in some way to these cases, but we do not know the source. In the coming days, as individuals are tested, we will know more about the potential spread of COVID-19 in PEI. Our focus will be to contain the spread of this virus. Self-isolation, early identification of cases, contact tracing, and quarantine of cases and their close contacts. We will be completing comprehensive contact tracing of all cases. We also have a roster of retired and experienced public health staff on standby in the event we need extra capacity to conduct contact tracing. This surge capacity means that all public health staff who are focused on delivering the vaccine to Islanders will remain focused on the immunization program as well. Islanders who have any symptoms of COVID-19 should be tested. They should not attend work or public events if they have any symptoms. The message is simple: stay home if you are not feeling well. I'd like to remind Islanders of the symptoms of COVID-19 that include new or worsening cough, shortness of breath or difficulty breathing, fever, chills, sore throat, running nose, sneezing, congestion, headache, muscle joint, body aches, feeling unwell, unusual tiredness, acute loss of sense or of smell or taste, and other symptoms like nausea, vomiting, or diarrhea have been reported, but typically along with other COVID-19 symptoms, although they may be seen more often in children. We have been here before. We will learn more and even more in the hours and days ahead. We may need to offer more testing, but we do have the capacity to do so. We will continue to make decisions based on what is happening in our community, on our test results, and always the decisions will be about containing the spread of COVID-19 and protecting Islanders. During these situations, more than ever, let us be patient and let us be kind. Thank you, and I'll open it up for questions.
Wayne Thibodeau, UBC.
Good morning, Dr. Morrison. Can we speak first of all, is this community spread that we're seeing in Summerside? And I know just by seeing some of the comments on social media, there's a lot of concern in that city right now. Can you speak to the level of concern and how concerned people should be in the community about what's happening?
Hi, Wayne. Well, I think we're always more concerned when we don't have a link to travel, and we don't have an index case or a source of the infection. And, you know, I think I mentioned, and we will certainly learn more in the hours and days ahead, especially as we test some of our close contacts and determine if the close contacts may have had a link as well to travel. So I think at this point it's difficult to know certainly how widespread any transmission would have been at all at this point, but we will learn more in the days, in the hours and days ahead, really.
And can I also get you to clarify for us, if you can, who needs to immediately self-isolate? I know you mentioned the Ironhaven Gym, but the breakfast spot and Domino's. So workers, customers, people who went in there. Can you clarify who needs to self-isolate immediately?
So, and I'm glad to clarify that. So really, it is only those who we identify as close contacts who need to self-isolate for an extended period of time. So that includes the people who were at the gym during the specified hours that we laid out, because they were there during a period of time in close proximity. The people who were at the breakfast spot and at Domino's, they are not considered close contacts, but they should be tested. And although the risk is low, it would be fairly quick interactions. We do want people tested, but they're not considered close contacts. And we are public health. Anyone who is a close contact, public health is calling, and these are the names of people who could be work colleagues, friends, who we are able to identify. But we're not able to reach everyone at the gym because we just couldn't get the right correct phone numbers and identify everyone.
Thank you very much for your time.
You're welcome.
Gabrielle Dumont, Radio-Canada.
Bonjour, Dr. Morrison. Donc, ma première question, c'est justement par rapport à cette grappe des cas qui ont été signalés à Summerside. Alors, est-ce que vous pouvez nous parler en français, s'il vous plaît, justement de la situation à l'heure actuelle? Qu'est-ce que vous avez fait jusqu'à présent pour faire le traçage de contacts et aussi la demande que vous faites présentement au public pour se faire tester? Est-ce que vous pouvez parler de cette partie spécifiquement en français, s'il vous plaît?
Bonjour Gabrielle, je vais quand même essayer. Alors, hier soir, on vient de identifier 3 cas de COVID-19 aux régions de Summerside. Et puis, on a parlé aux contacts et puis nous sommes en train, depuis hier soir, d'identifier les contacts qui sont proches d'eux, les personnes qui travaillent avec, qui sont amis. Et puis, on les contacte pour qu'ils isolent pendant 14 jours depuis leur dernier contact avec le cas. Et ils vont aller faire tester aujourd'hui. En addition, on a plusieurs personnes qui sont on pense qu'ils sont des contacts proches qui ont été au Ironhaven Gym au Summerside. Et puis, on a fait les appels hier soir et on n'a pas contacté tout le monde. Alors, on demande aux personnes qui sont là depuis le samedi, le 20 février et le mardi, le 23 février, entre 6 à 8 heures le soir, de isoler aussi, d'être testé et puis appeler 1-800-958-6400 pour s'ils n'ont pas eu un appel de santé publique. Et puis, on demande aussi s'il y a des personnes qui font la visite au breakfast spot à Summerside le 20 février, le samedi, entre 7 heures le matin et 2h30 l'après-midi, de faire tester. Ne doivent pas isoler après leur test, leur premier test test négatif, mais il doit faire attention aux symptômes. Et on a plusieurs temps aussi, même chose pour le Domino's Pizza à Summerside. Et puis, on encourage tous les gens qui ont n'importe quel symptôme de COVID-19 d'être testés aussi, parce qu'on est en train de voir l'impact ou s'il y en a plus de cas dans la communauté.
Parfait. Et ma deuxième question, ça serait par rapport justement aux 2 cas qui ont été annoncés mercredi. Vous avez dit que l'une des femmes qui avait contracté la COVID-19 avait commis 2 infractions aux mesures de santé publique. Ma question, c'est est-ce que vous pensez que les insulaires respectent moins bien les consignes de santé publique maintenant? Est-ce que vous pensez que les gens commencent à baisser leur garde? Et parce que ça fait quand même déjà 1 an qu'on est dans cette pandémie. Alors, est-ce que vous pensez que les insulaires respectent moins bien les consignes, surtout les consignes d'auto-isolement?
Gabrielle, je pense que la majorité des insulaires, même maintenant, ils suivent les consignes tellement bien. C'est vraiment la plupart des insulaires. Je sais qu'il y en a, on a toujours eu un montant un petit nombre de personnes qui ne veulent pas les suivre ou pensent peut-être que c'est pas une grande chose et ils vont pas suivre les consignes, mais la majorité des personnes suivent encore. Et puis je pense que les insulaires, c'est que on est en train d'être vaccinés, on espère d'être à un moment donné de vivre un peu plus normal et on veut continuer de suivre les consignes jusqu'au moment quand on est presque là, on a peut-être quelques mois qui suivent avant que on ait, j'espère que tout va bien. Alors, je pense pas que c'est la majorité des personnes. Alors.
Parfait. Merci beaucoup. Bonne journée.
Bonne journée. Just before I go on to the next, I'll translate that last question. It was about whether or not I thought islanders were not following the guidance around public health measures in the same way. And I think islanders, the majority of islanders continue to follow these public health measures. And I know there may have always been some that haven't followed them in the same way or have ignored them, but by far the majority have followed the public health measures in this last almost year. And we thank islanders for that. And I think we've said it at different times. There's more behind us than ahead of us, and I think the majority of islanders feel like if we can just keep going a little bit longer, follow the measures, make sure we get people vaccinated here, then it will mean that we can all start transitioning back to some of the things we love to do in the way we love to do them.
Julian Lecachere, Radio Canada.
Bonjour, Dr. Morrison. Dr. Morrison, vous avez répondu en anglais en expliquant qu'on ne parle pas. C'est trop tôt pour dire que c'est une transmission communautaire à Summerside. Je voudrais savoir, Dr. Morrison, comment vous pourriez comparer cette situation à celle qui s'est produite à Charlottetown dans les écoles. Est-ce que c'est à peu près similaire ce qui se passe à Summerside? Est-ce qui s'est passé à Charlottetown en décembre dernier?
Bonjour. Il y a des choses qui sont similaires, mais on a maintenant l'expérience on prend des autres cas qu'on a eu sans avoir avec le voyage, c'est pas lié au voyage. Alors, Il y a beaucoup de similarités et puis on va voir vraiment qu'est-ce qui arrive avec les autres tests aujourd'hui, avec les contacts qui sont proches, vraiment avant de faire d'autres décisions. Mais j'imagine que ça serait plus tard aujourd'hui, avant la fin de la journée, qu'on va avoir plus d'informations qu'on va relier à la public.
Donc, docteur Morrison, c'est une possibilité de voir les restrictions revenir en place, de voir des magasins, des endroits, des lieux fermés à Summerside très rapidement?
C'est une possibilité, mais à ce moment, et je pense que c'est important de faire les décisions à propos de l'information et qu'on a les résultats des tests et ce l'information qu'on reçoit pendant la journée. Mais on ne voulait pas attendre jusqu'à la fin de la journée aujourd'hui avant de donner vraiment les locations pour les gens de signaler d'être testés. Alors, mais on doit faire les décisions plus tard dans la journée ou peut-être pas demain matin.
Merci beaucoup.
Merci.
Louise Martin, CBC.
Hi there, and good morning. Thanks for taking our questions today, Dr. Morrison. I'm wondering about, is there going to potentially be more public exposure information for Islanders? I know that some companies have taken it upon themselves to take to social media and post that one of their employees has been tested positive. So I'm just wondering how that all works with a public exposure notice.
Well, certainly there'd be public exposures are about where they're not necessarily where businesses where we can track every person that's in a particular business if it's not open to the public. Public exposures would be, locations like we've listed, restaurants, we've done grocery stores, those kind of places where we aren't able to identify a particular business. So if we find out more places, certainly if we have more cases and they have other public exposures, we would do that. But certainly these are the public exposures that have been identified by these 3 cases at this point.
Thank you very much. And I'm just wondering about the call out for testing. When we had a similar cluster in Charlottetown, and I believe it was 2 employees at Wendy's restaurant, there was a targeted testing for people between the ages of 20 and 29. Is there any thought of doing that again and sort of really honing in on targeting people who do not have symptoms and weren't even a part of the public exposure places?
Yes, Louise. So there we are absolutely considering that and have had some discussions with Health PI, and that will be available. And again, as we learn more during the day, there'll be further information on that, if not later on today, first thing in the morning.
Okay, thank you very much.
You're welcome.
Dave Stewart, The Guardian.
Good morning, Dr. Morrison. Just had someone pass along some information that the PEI Bank Company in Badek had sent its employees home and closed. Any confirmation on that? Or?
Well, I mean, I think, and that may be also what Louise is referring to. So there are, if there's a case identified with a business where we're doing testing of a particular closed business that's not open to the public, then we don't list that as a public exposure, but so there would be other, just like we've had in other outbreak situations, companies that will be affected and impacted by a case.
Thank you. And also heard that the Yarmouth Summerside Maritime Junior Hockey League game doubleheader has been postponed this weekend. Is there any connection to the Summerside cases there?
Not a connection, but it was my recommendation that was relayed to the Western Capitals that we not have other teams coming in this particular weekend as we're trying to do additional testing and establish what is going on.
Thank you very much, Doctor.
You're welcome. I think that's it. So thank you very much.